Feelings and emotions are the products of 3.5 billion years of evolution, making them powerful and having a profound effect on human reactions. Ignoring them makes CBT technique shallow and superficial. Ignoring past experiences that may influence current behavior can also make this technique superficial. Consequently, therapeutic effects of the technique are not permanent. Underlying emotional conflicts remain unresolved and re-emerge as the same symptoms or other psychological problems. Hey everyone, today I want to talk about the integration of behaviorism and cognitive theory into cognitive behavioral therapy or CBT and some of the criticisms it faces. Let's dive in. So, what exactly are behaviorism and cognitive theory? Behaviorism, pioneered by scientists like John B. Watson and B.F. Skinner, focuses on observable behaviors and how they are influenced by their environment. It's all about conditioning. Think of Pavlov's dogs or Skinner's pigeons. On the other hand, cognitive theory developed by researchers like Aaron T. Begg emphasizes the importance of mental processes, how we think, perceive, remember, and learn. It explores how our thoughts influence our feelings and behaviors. CBT, or cognitive behavioral therapy, merges these two perspectives. It combines the focus on changing maladaptive behaviors in behavioral approach with the emphasis on changing negative thought patterns in cognitive approach. In CBT, therapists help clients identify and challenge distorted thoughts and encourage them to change their behavior through various techniques like exposure therapy and behavioral activation. It is claimed that CBT is effective for treating a variety of mental health conditions, including depression, anxiety disorders, PTSD, and more. It is also claimed that CBT's structured, goal-oriented approach makes it accessible and practical. However, CBT has been criticized for suffering from some major deficiencies. One major criticism of CBT is that it may oversimplify complex emotional issues by concentrating mainly on thought and behavior patterns, ignoring underlying repressed feelings and emotional conflicts. Feelings and emotions are the products of 3.5 billion years of evolution, making them powerful and having a profound effect on human reactions. Ignoring them makes this technique shallow and superficial. Some argue that it can be too focused on the present, neglecting past experiences that may influence current behavior. Ignoring past experiences can also make this technique superficial. One significant criticism is about the permanence of CBT results. Follow-up research shows that the therapeutic impact of the technique may decline a few months after the end of therapy. Therefore, it can be said that the therapeutic effects of the technique are not permanent. This might be due to ignoring underlying emotional conflicts that remain unresolved and re-emerge as the same symptoms or other psychological problems. It is also very important to mention that applying the principles of cognitive behavioral therapy in dealing with children can have a major negative impact on their self-esteem and mental health, and consequently on the mental health of society in general. They suggest that parents ignore their children's feelings and emotions to avoid reinforcing negative behaviors. However, this approach ignores children's attachment needs and can make them feel helpless. We'll discuss this in more details in a separate video later on. Thanks for watching. If you found this video helpful, don't forget to like, comment, share, and subscribe for more content on mental health and therapy. See you next time.